You open your eyes, still a little groggy. The room is quiet, the air is cold, and for a second everything feels normal. But then comes that realization you can't unsee. The usual sign didn't show up. It's not just about a morning erection. It's like your body failed to turn on a light that for years you never even thought about. And when that starts to falter, almost every man runs the same internal loop. Am I getting old? Is this stress? Is there something wrong with me? And what concerns me most isn't only sexual function. It's what this change might be saying about circulation, vascular health, and overall energy. Today, I want to explain, calmly and without sensationalism, why this happens with age and what can actually be done in a serious, safe, physiology-based way. No easy promises, no shame, and no feeling like you're somehow breaking on the inside. I want to validate something many people try to swallow alone. This affects you. It affects your self-esteem, your identity, your confidence. Sometimes it starts subtly. You still have desire, you still feel attraction, but you notice your body responds more slowly, or it responds but doesn't sustain. In other cases, the morning erection disappears first, and weeks or months later, intimacy starts to feel unpredictable. Then comes the domino effect in everyday life. Men begin to avoid situations, staying in bed too long, initiating affection, taking a shower together, even conversations that could lead somewhere, not because of a lack of love, but because of the fear of failing. And that creates a quiet kind of anxiety. You might be fine at work, solving problems, smiling, but underneath there's a tension. What if it happens again? I see men who were never insecure, men who were always solid, start to doubt themselves. And the worst part? Many think it's overreacting to feel this way. It's not. It's human. And there is an explanation. Let me ask you honestly, when you first noticed this change, did you talk to someone, or did you keep it to yourself? Have you ever caught yourself thinking, if I don't talk about it, maybe it'll just go away? Do you feel like your mind still wants it, but your body doesn't always keep up? And more importantly, have you ever stopped to think that an erection isn't just about sex? It's about circulation, blood vessels, the endothelium, nitric oxide, a reflection of what's happening inside your body. If any of this feels familiar, stay with me. The goal here isn't to scare you, it's to give you clarity, and clarity gives control back. As a doctor, I see this every single day. Men who are 35, 45, 55, 65, different backgrounds, different lives, but the same feeling. Doctor, I'm not the same anymore, and I like to explain this using an image almost everyone understands. Imagine a dam that needs to fill a reservoir. The water flows strongly through the river, but there are gates that must close tightly for pressure to build and be maintained. Early in life, those gates are firm. They seal properly. The reservoir fills completely and stays stable. Over time, because of wear, rust, build-up, tiny mechanical damage, those gates become loose. The water still flows in, but it leaks out through small gaps. The reservoir fills only part way, and before it reaches the ideal level, pressure starts to drop. That's exactly how many men describe early erectile dysfunction. It starts, but it doesn't last. It's not a lack of desire. In many cases, it's a vascular retention system that no longer seals the way it used to. Now let's bring in the science. Simply, an erection happens when the brain sends signals that increase the release of vasodilating substances, especially nitric oxide, which relax the smooth muscle of the blood vessels and allow blood to flow into the corpora cavernosa. But blood entering isn't enough. For rigidity to occur and be maintained, the body must retain that blood, reducing venous outflow. Just like the dam, you need both strong inflow and well-sealed gates. With age and with factors like physical inactivity, excess sugar intake, chronic inflammation, high blood pressure, abnormal cholesterol, smoking, stress, and poor sleep, The endothelium, the inner lining of the blood vessels, loses efficiency. It's as if the dam gates develop rust. They still close, but they don't seal. Pressure drops, support fails. And that's why morning erections, which are closely linked to vascular health and the hormonal balance of sleep, are often one of the first things to change. If this content is making sense to you and helping you understand your body better, take a moment to subscribe to the channel. Here, I talk about men's health in a serious, safe, evidence-based way. And let me reinforce one important thing. This is not about being less of a man. This is about blood vessels. And blood vessels age, but they can improve when you take care of the foundation. Now, I know what many people think at this point. Doctor, what if I take something quick? This is where the most common methods come in. Pharmacy medications, teas, miracle pills, and the famous blue pill. The problem is that most of these strategies work like forcing more water into the dam without fixing the gates. You may increase the flow for a while, raise the pressure momentarily, but if the sealing mechanism is worn out, you still have leakage. That's why so many men live in a heavy emotional cycle. One night it works, the next it doesn't. One day it improves, the next it drops. And this instability turns into anxiety. Anxiety worsens the response, and the person starts avoiding intimacy again. From a biological point of view, the central issue is this. Palliative solutions mask the problem, but they do not restore arterial elasticity. They do not recover the endothelium, and they do not strengthen the retention system. Without rebuilding the physical foundation, improvement tends to be temporary, and frustration returns when the effect wears off. Now let me make you think. What if your body wasn't asking for medication but for reconstruction? Reconstruction here means supporting the body in recovering internal conditions so that blood can enter and the gates can seal better again. Improving nitric oxide availability, reducing oxidative stress, supporting microcirculation and nourishing the endothelium over time. And that's where a natural solution with physiological logic comes in. A nutritional protocol with a well-formulated supplement that brings together active compounds already studied for vascular support. Not as a magical promise, but as a practical and consistent tool for those who want to act in an organized way. I need to warn you as a doctor, vascular health does not stand still. You are either improving or you're getting worse. If you ignore repeated signs, such as failures in morning erections and maintenance, the process can progress. And in some cases, the more time passes, the harder it becomes to fully reverse, because the loss of elasticity and endothelial dysfunction can become established. Acting early is smarter than trying to catch up later. And when the foundation starts to improve, the benefits many men notice go beyond the bedroom. You feel more energy in the morning. Sleep tends to become more restorative. Performance in training and at work improves. Mood feels less heavy. And yes, confidence comes back in a way that seems simple, but changes everything. You stop calculating, imagining, anticipating failure. You go back to living the moment. If you want to learn about this type of vascular support protocol, I recommend that you check the information on the official website. There you can understand the proposal, the components, and the way it is used within a nutritional logic. And I make a point of explaining something important. Processes of renewal of vascular endothelial tissue usually take around 120 days, according to the scientific literature. That's why long-term nutritional approaches, around 3 to 5 months, are often used in vascular health support practices. This is not individual clinical treatment, nor does it replace a medical consultation. It is a nutritional support strategy, and each case requires medical evaluation, especially if you use medications, have diabetes, hypertension, or a cardiovascular history. The link to the official website is here in the video description. And I know there is a very real fear, embarrassment about buying, fear of someone seeing it, fear of something giving it away on the packaging. So I want to reassure you clearly, the delivery is completely discreet, neutral packaging, no product identification, no supplement name, and no embarrassing information. It is safe, professional, and no one needs to know what you purchased. I want to finish with an idea that changes the way you see this. Taking care of your erectile function is not vanity. It is health. It is self-care. It is respecting your body and your future. You don't have to carry this weight in silence, nor define yourself by a phase. The body gives signals, and signals are invitations to act intelligently. Ignoring these signs doesn't make you stronger. It only makes you postpone a conversation your body has already started. When you understand what's happening inside, anxiety decreases, fear loses its grip, and decisions become rational, not impulsive. Information gives control back, and control restores dignity. If this content helped you see your body more clearly, hold on to this. You don't have to accept decline as destiny. There are paths based on physiology, time, and consistency, and every conscious step is already a form of care. Take care, and I'll see you in the next video.